Hey guys, I'm Dr. Nelson. Hey, I'm Dr. Nelson.
Hey, I'm Celine. This is Coffee with the Dentist. What's the most surprising reason someone's given you for putting off treatment?
I think we had a patient, he wanted to make sure he looked really, really good in front of his ex-wife. Yeah, I think that was probably one of the best ones.
But I mean...
Because he did look good. At the end of it, yeah.
He had a cracker smile after that, yes.
Yeah, but yeah, most of it's just, some people are embarrassed and that sort of stuff, but no, typically for that one, that was probably the best.
That was the best one. So do you think patients are more scared of what we're gonna find when we do an exam or the treatment price? The price, right?
Oh, to be honest, I think a bit of both. It kind of depends where they're coming from, really.
Yeah, so
Some
true.
people definitely don't like the cost, and other people are just, super embarrassed about what we find or how they've let it get this far.
Hey, but what about those people who come in and think it's crazy, crazy bad? You know, we've got to do a full mouth of whatever we need to do. And it turns out they just need a bit of a clean and polish, maybe a couple of fillings.
Yeah, that's always a nice surprise.
The best case scenario for us, yeah.
Both aspects.
Yeah. You know, we answer a lot of questions in consults and everything. What question do you think patients never ask us that they probably should?
How's my day?
Oh, it's all about you, Nelson.
No, I think sometimes a lot of the people is more so how could I prevent it? Or how could I avoid this?
Because that's where our mentality is,
that's
prevention.
to hear.
Yeah.
But I guess it's probably not the one that's asked all the time. So do you reckon like all of these social media videos and all the things that we do now, people are more informed or more confused?
That's a toughie. I think there's so much more information, but then there's so much more misinformation. It's a double-edged sword with that one. I like how accessible information is for patients, but everything changes from doctor to doctor. You would know that. State to state, country to country, you know.
Whether it's specific to them or not, or
Yeah, so true. They don't know what treatment they need until they see a dentist.
they always need a professional opinion, I think.
That'd be nice. So have you changed the way that you explain things to patients? Because, you know, we always have that one patient that just makes us think about something else.
Certain people, like I sit there and start using bigger words and things like that, that it's so normal for being on the inside of the dental game that, I can explain it super easier to all my dental friends, but obviously explaining it to people is like another language. So I have now learned to tone it down or use
Patient-friendly language.
what's the word? Analogies that is more specific to the patient.
You've got great analogies, actually. What's a few of your favorites? There's, you wouldn't buy a Porsche and not take it to the mechanic for a service. You love that one. What?
I've never said that.
You've absolutely said that.
It's a Ferrari.
Oh, it's a Ferrari. Sorry, pardon me.
No.
Consults are funny because people come in with myths that they've read online. Again, the misinformation everywhere can be really
Probably the most not approachable, but like the most explainable one is like people go, I don't brush my teeth because it brushes off my enamel.
That hurts me inside.
Yeah. I mean, if you brush your teeth with a wide toothbrush for many, many years, it will. But a normal toothbrush won't. Do you reckon people would underestimate how much a smile makes a difference in their life?
Yeah. Oh my God. I think people come in and they recognize the actions that they do, like, oh, I'll cover my mouth because, I don't want to like spit on people if they're missing teeth. I don't want to like have bad breath because I know I do. But then they have a full healthy smile and they're all of a sudden talking to people on the street. They're smiling without realizing it. It is like changing a person from the inside.
Yeah.
So when would be the best time for someone to start treatment? Are there things that they probably need to think about before coming in?
Yeah, there's definitely, look, there's no real wrong time to have a consultation and a checkout to see what's going on. But there's definitely timing factors that can particularly play into medical history issues. If you're going on anti-resorptive medication for your teeth per se, you can't all have everything sorted before you go on those. Or if you're in between bouts of chemo or any other immunomodulated diseases, things like that.
Yeah, for sure.
So definitely that needs to be structured and timed correctly, but in a general sense, no, there's no better time than now.
There's no better time than now, you're so right. So that was Coffee with the Dentist. And I guess from today's conversation, we've gathered that everyone's journey is a little bit different, but there's no better time than to start now. Because in Dr. Nelson's words, things can snowball pretty quickly.
Thanks for joining us.
Yeah, we'll see you next time.